Let's bring in real-world case study to illustrate how medical cannabis can be implemented in practice. And there is no better example than in Israel, a country often considered as a pioneer in medical cannabis research and policy. So Israel has a unique ecosystem. It started researching cannabis early, thanks to the Professor Meshulam in 60s, and over the decades it developed a government-supported medical cannabis program. So by 2000, Israel had a formal framework where patients with certain conditions could get cannabis under doctor's guidance. This program has grown significantly and often is cited as a model balancing between innovation and regulation. One story that I find very inspiring from Israel involves a nurses advocacy group at an organization called Medic. So it was in Israel, and this group was working with elderly patients, many in chronic pain with other problems, who had never considered cannabis as a medicine. They actually taught the seniors how to smoke cannabis properly, which is fascinating because it's not something that you imagine that the nurse will do. They had the classes for the seniors, the session how to prepare a joint, how to light this cannabis cigarette, how to inhale safely, and dose themselves. So this group of patients were very large. There were 70, 80, 90 years old patients. Many of them experienced significant pain relief, better sleep, and improved appetite after starting cannabis. Their quality of life improved to the point that some could reduce their reliance on opiates and sleep medication. So those were the story was so impactful from a social point of view that the Israeli government, based on this, started to regulate more and more medical cannabis use for other indication. Can you just explain how in Israel this patient motivation was inspiring Israeli health authorities to implement this cannabis program and how it started?
Well, it started from advocacy groups, and what's interesting is you mentioned that it was cannabis was referred in the Bible. It was probably something that our people used many years ago, maybe before they wrote some of the things that we now read in the churches and synagogues. So cannabis was used many years ago, and the religious people in Israel were one of the most vocal for the use of cannabis in first compassionate use in oncology, but later in the elderly. And so that was, it didn't come from the scientists, it came from the public, advocacy groups trying to get it into the use, and it was initially adopted more by the nurses than the doctors, so there was definitely a push by the different people that were trying to help these patients, and the doctors eventually saw the data. I mean, it was really, the doctors were actually pulled into this using of cannabis because they saw the effect on the patients.
So this is like, first of all, like as you said, the patient were a group in this association with the nurses. So these cases were described obviously by media and the Ministry of Health. They were pushed to give them more and more license for the doctors to prescribe medical cannabis. But could you explain us how it started? So we know that in 2000 they created this specific group of experts in Israel named Yakar.
Yeah.
Elaborate, please, here how the Israeli government implemented this program to real life.
Well, the cannabis unit in the health industry was created to regulate and develop guidelines. And one of the first things they did was develop a guideline, a book called the Green Book, that actually my group was helpful in writing that book. The idea was to develop guidelines for the use of cannabis, to educate both the doctors, the pharmacists, the nurses, develop the guidelines for the maximum dose that was allowed. I don't know what the regulations are in different countries in Europe, but in Israel there is an upper limit of how much a doctor could prescribe per patient. And so they developed that, the guidelines for which indications to use, what type of formulation to use for different indications, and that became this, let's call it the Bible, the standard for the use. And a doctor that wanted to prescribe cannabis had to go through training and get a certificate. I don't know what's happening in Poland, but that was how it was done in Israel, is that doctors had to be trained, nurses had to be trained. There was a lot of work to educate the doctors and the nurses. But frankly, I think it only took off when there was less of a stigma, when the grandmothers were starting to use cannabis. And there's a joke that the doctor told, but I'm not sure if that's not. But the patients would come to use cannabis because their grandchildren would visit them more often. So there was definitely. It was no longer a stigma. It's not a stigma in Israel anymore. People are using cannabis frequently, even the grandmothers and the grandfathers. So that became the standard.
So obviously, but I would say that stigma we take out mainly also with from the scientist or the medical doctor, because we offer the training. So education is the key, based on the experience from Israel.
Education of everyone. It's not the education of the doctors, education of the nurses, education of the public. Creating awareness, knowing that it's regulated helps, because you know that it's something you're getting that is regulated, not necessarily as a drug, but regulated as something that is a controlled substance, that you know that there's quality control. So I think that was a big part of it, is that it was a regulated, and it became a regulated industry.
So we can say it started by patients, then by nurses or devoted some individuals, and then government, because it was pushed by the media obviously, started to regulate, proposed this green book as a kind of clinical guide for the doctors how to start the therapies and titration models, which kind of products under the quality supervision and GMP of pharmaceutical industry they could prescribe for the patients. And again, education.
Yeah, and then let's not forget that Israel has a centralized healthcare system that helps, because there are 4 HMOs, but 2 really control over 70% of the population. So having a centralized healthcare system helps in getting developing the standard guidelines and getting awareness and training the different stakeholders in giving these therapies.